Welcome back to the Health Literacy series. This is part 3, Communication Strategies. In parts 1 and 2, we discussed the definition of health literacy and the impact it has on our patients and the health system. Today, we're going to talk about how we as providers can help fulfill our health literacy responsibilities. We will discuss strategies for effective communication, including using universal precautions and plain language and user-friendly materials. The universal precautions approach simply means we should be communicating as clearly as possible with everyone. You can't tell a person's literacy level by looking at them. You just can't. A group of residents were asked to try. They identified 10% of their patients as low health literacy, when really it was over 1/3. The language used in the health field is not commonly used in everyday language, and even those with a good educational background can't be expected to know exactly what their diagnosis means or what is being asked of them if it's not communicated clearly. Think about it like this. I can read, but I would still appreciate clear, jargon-free instructions and checking for understanding before going scuba diving for the first time. Even someone who normally manages health information, when they're feeling anxious or overwhelmed or presented with too much at one time, they will not be able to understand or use health information as well as normal. 9 out of 10 adults struggle to understand and use health info when it's complicated. At the end of the day, it's best to use simple, clear language to avoid any opportunity for misunderstanding. To compound the issue of effective communication, patients immediately forget up to 80% of what they are told during an office visit. And yes, that goes for healthcare providers as well. On top of that, only half of what we do remember is remembered correctly. So best to be as clear as possible from the get-go. We also have to consider the difficulties with face-to-face communication. Patients don't understand jargon, and we don't communicate as clearly as we think. One study showed that jargon terms were typically repeated 20 times during a genetic counseling session, and out of 800 pediatric visits, only one mother ever asked for clarification. Out of 250 orthopedic patients at their first post-op visit, less than half even knew if they should be bearing weight. And while almost all surgeons thought their patients knew when to resume activities, they had actually communicated that information to less than 60% of their patients. While it's imperative to communicate clearly with all of our patients, we should also be aware of some behaviors that could indicate that a patient is facing additional barriers or that we need to do a better job in communicating. For example, frequently miss appointments. That could be that the patient is unable to read the appointment slip, or it may also mean they don't have an organizational system at home to remember appointments. Incomplete registration forms may result because the form is overly complicated for that individual patient. Non-compliance with medication therapy. The non-compliant patient, a favorite buzzword of clinicians. Many clinicians get very frustrated with patients who don't take medication correctly, but this may result not because the patient doesn't want to do it right, but because they don't have a clear understanding of the importance of the medication. And some people don't understand how to get medications refilled. Some people are unable to name medications, explain the purpose or dosing, or they identify the pill by looking at them and not reading the label. These could be signs that they need some additional help. Patients that are unable to give a coherent sequential history, the quote, poor historian. This could be a more specific sign that the person has had trouble in school, because one of the things that school teaches us is how to organize our thoughts and presentation. Asking fewer questions. If the patient is one who does not ask questions, he or she may be trying to hide that he or she does not understand. Lack of follow-through on tests or referrals, a common frustration for us as clinicians, but what we don't consider is that the patient may be struggling with understanding how to make the follow-up occur. Now it's time for a quiz. True or false? Literate patients are insulted by low literacy materials. False. Everyone appreciates easy to understand information about their health. We all feel health illiterate when hearing a new diagnosis. 2. You can tell by looking if someone has low health literacy. False. You can't tell. Health literacy is a universal problem. Health information is difficult for many people to understand, regardless of race, education, or socioeconomic background. A college degree means the patient will understand medical information. False. On average, people read 3 to 5 grades lower than the last year of school completed. Even some of those scoring at the highest general literacy levels still fell into basic and below basic health literacy categories. Many of my patients have problems understanding health information. True. Remember that graph way back in the first lecture? Only 12% of adult English-speaking Americans are at a proficient health literacy level. So let's discuss some strategies we can use to help communicate more effectively. Number 1, slow down. Slow down. Not much more explanation needed here. Number 2, use plain language and avoid medical jargon. Seems simple enough, right? Let's take a moment to practice. Here's a list of 20 commonly used words. Words that are considered complicated by many of our patients. Can you think of other words we could use in their place? Pause the video and give it a go for a second. Here are some more examples. Instead of annually, we could say every year. Arthritis, pain in joints. Cardiovascular, having to do with the heart. Dermatologist, skin doctor. Diabetes, blood sugar. Hypertension, high blood pressure. Here's an example from a CDC publication called Everyday Words for Public Health Communication. It's like a dictionary / thesaurus to help turn common medical jargon into plain language. For example, acute, a word we use all the time in healthcare setting. And here's their sentence. Mumps is an acute viral illness. All right, so how do we turn that into plain language? Try, mumps usually cause the following symptoms for about 7 to 10 days. Fever, headache, muscle aches, etc. Can you identify any words in their plain language sentence that also might be confusing to some patients? Now pause the video and take a few moments to look over these medical terms and see if you can translate them to plain language phrases. Here are some suggestions. Feel free to pause and look them over. Notice if there were any words that were harder for you to translate into plain terms than others. Now let's consider a scene of a doctor talking to a patient about their hypertension. If you're watching this in groups, split into pairs. If you're watching solo, just imagine how a conversation like this could go and what common medical jargon terms may be used. Then see if you can replace at least 3 medical terms with plain language. Here is the scenario. The patient has just been diagnosed with high blood pressure and will need to make serious changes to her diet, like eating fewer high-fat, high-calorie foods and consuming less sodium. And she'll need to start taking medication. Here's one example of what a doctor might say to get you started. Feel free to translate this one into plain language or come up with one on your own. Doctor, Mrs. Johnson, your blood pressure over the last 4 visits has averaged 150/100, resulting in a diagnosis of hypertension. In order to treat this, you will need to take a medication called Hytrin and make some substantial life changes, including a low-sodium diet. What words can be replaced here? Our next strategy is using user-friendly materials to help with communication. 50% of adults cannot read a book written at an 8th grade level, and 45 million are functionally illiterate. Health-related info is usually written at a 10th grade or higher level. Does this add up to positively promoting health literacy? Definitely not. Look for patient-friendly materials that have short and simple text, avoid jargon, limit the info to 1 to 3 key points, and emphasize what actions the patient should take. Be sure to use reliable resources when getting info for your patients, and help your patients do the same. Warn against Dr. Google or pharmaceutical-sponsored sites. See if they have internet access and suggest reliable, easy-to-navigate websites like Medline Plus, which has a section called Easy to Read Materials for easy access. If they don't have internet access, try to provide them with appropriate materials to take home. Pictures can be great teaching tools. So in this lecture, we discussed some strategies for effective patient communication, the universal precautions approach, using plain language, and choosing patient-friendly materials. Next time, we will discuss the Ask Me 3 strategy and practice with the Teach Back method. See you next time!